The investment group LeapFrog has spent $22 million to acquire control of the East African chain of pharmacies GoodLife. Now, that chain of pharmacies has about 600,000 customers in the region. Dr. Felix Olale is a partner at LeapFrog. He's been telling me how people are increasingly using pharmacies. So, go to your local pharmacist for advice. Get medical advice at the pharmacy because, at the end of the day, a lot of people just can't find a doctor.
There's going to be an additional 50 million people in Africa over the next 20 to 30 years who'll make between $10,000 to $20,000 a year. So incomes are rising. The demographics are also changing. People are moving into cities. They're getting afflicted with chronic lifestyle diseases. And so as you have this demanding consumer who has more income, they are also demanding a shift in the type of healthcare services that are available to them.
Now, here at the BBC, for decades, we've looked at healthcare from an African perspective with the worry of malaria, for example, which is still rife across the continent. But are you saying that the kind of worries that people living in cities in the richer parts of the world, whether it be North America or Europe, things like diabetes are becoming a greater worry in Africa than things like malaria?
Absolutely. So by 2030, issues like diabetes, oncology, and cardiovascular disease will be the top afflictions that affect people in the low and middle income communities across Africa. That's not to say that malaria is no longer an issue. It's just to say that we actually have to prepare and invest in business models that focus on both issues. One of the biggest issues in malaria medications is a question of quality. To be able to control the integrity of their supply chain, literally being able to track a particular medication all the way back to the manufacturer. And at the same time, they're also able to offer this medication at a cost-effective price.
Now, here in the UK, of course, we have our National Health Service, which is free healthcare available at the point of delivery. Someone can walk in a hospital, someone can go and see their GP or doctor and know it will not cost them anything. But it varies across Africa, the situation with healthcare, doesn't it? And that must be a real challenge for governments which want to drag the economy of the country up, because a healthy workforce is really vital to any economy.
Absolutely. In most of Africa, 50% of the healthcare delivery services comes from the government. The other 50 is actually private sector. So you cannot focus on one side without focusing on the other side as well. And governments are doing two things that I think are important in the market today. So on the one hand, there's actually a big drive to offer universal healthcare coverage, which allows people to pay for medications, pay for services, hospitals and pharmacies. On the other side, the private sector is also tailoring products, again, focused on this consumer that is low and middle income, to begin to solve a challenge that says, listen, if you can afford a little bit more, then you also have a greater variety of services. If you can afford a little bit less, we will tailor a product that is still profitable, but at the same time can actually solve this particular challenge as long as you have enough volumes.
Now, you're heading into the area of health insurance there. Many people in the Western world with mixed approaches to the economics behind healthcare effectively pay for their own health insurance. Do you think that's a growing business in Africa then?
Oh, health insurance is a big business in Africa. So penetration is very low today, less than 5% for private health insurance, but it's actually the fastest growing component of health, actually insurance globally. So we not only invest on insurance companies in our financial services business, but we also invest in healthcare companies. So effectively, we're investing in both the payer and the provider, and we believe that scale in these markets will actually happen at the intersection. Now, that's the thoughts of Dr. Felix Olale talking to me. He works at the investment group LeapFrog, which has acquired control of the GoodLife chain of pharmacies in East Africa. And I think it's worth noting the continent's healthcare system does face many big challenges. I think, of course, of counterfeit pharmaceuticals or counterfeit drugs. That is one real problem across the continent. Urgently needed medical equipment too. MRI scanning machines sometimes get caught up in the gridlock of international customs. So you can see that healthcare faces quite a lot of challenges. And I think governments have a role to play. There is this mix of the public-private partnership, as pointed out by Dr. Felix Olale there from LeapFrog.